In the last few weeks, we've had some good news around government's COVID-19 vaccine rollout. The country has secured enough doses to vaccinate most of the population. Millions of vaccines will be manufactured right here in South Africa. And government's online registration system is now open to senior citizens above the age of 60. But despite all the good news, the story of this vaccine rollout has been one of false starts. We've set ambitious targets: 40 million by the end of the year, 1 million health workers before the end of March, but we've been unable to fulfill them. The stark reality is that so far, not a single ordinary South African has received a vaccine. We've only been able to give about 300,000 jabs to our more than 1 million healthcare workers. People over 60 will only start getting theirs from the 17th of May. One man who's been vocal in his criticism of the slow pace of the rollout has been Professor of Vaccinology at Wits University, Shabir Mahdi.
So any plan to start rolling out vaccine is very welcome. But at the same time, I think the rollout of the vaccine is going to be somewhat late.
The former member of the Ministerial Advisory Committee on COVID-19 says the 17th of May, the official start date for those over 60, is around the same time many experts are predicting the dreaded third wave, a resurgence of coronavirus infections.
For these vaccines to work, you need to have at least a 14-day period before the vaccines really starts kicking in. Vaccinating in the midst of a resurgence is simply not going to have much benefit during the course of that particular wave.
Currently, less than 1% of our population has been immunized, whilst a country like Israel announced this week people there no longer have to wear masks outdoors, having vaccinated more than half of all adults. Minister of Health, Dr. Zweli Mkhize, says things should start moving a lot faster come mid-May. Minister, once people have registered, there's been a sense of apprehension around not knowing some of the details. In other words, if I were to register, for example, what number would I be in the queue? What site would have been identified for me to go and get vaccinated? How will all of that work?
The electronic vaccination data system is trying to establish the location of the individuals, so it should be able to indicate the nearest facility nearby and therefore send a message to say your center such and such an area based on your address that you would have given.
The electronic vaccination data system seems to be running smoothly, with the roughly 350,000 people who've registered so far being told they'll be notified of the next steps via SMS. Government has been criticized for the lack of granular detail for the rollout plan, but here's what we know so far. We've secured 31.2 million units of the single-dose Johnson & Johnson vaccine and another 30 million double-dose vaccines from Pfizer.
Which means together the two will be able to give us 46 million vaccines.
Phase 2 of the rollout will target 16.5 million people and will last from mid-May to mid-October. That will include the roughly 5.5 million people over the age of 60 and hopefully all of our healthcare workers. The remainder of the Phase 2 vaccines will go to the people over the age of 40 who are frontline workers or who have comorbidities, and government will announce when they can register.
The next highest level of ill health, severity of disease, hospitalization is amongst those who have 40 years and above.
Over 2,000 sites have been designated for vaccine distribution. The EVDS will notify you when it's your time to go. Vaccines are not mandatory and no one will have to pay to receive one. The minister is urging every South African to get their shot.
We encourage people for their own safety and for the sake of their own health that they must use the vaccines.
So how safe are these vaccines? That's the million-dollar question, because without it, life is not going to return to normal. Places like this that used to be pumping and full of people are going to stay empty. On the 13th of April, the minister announced South Africa would temporarily suspend its Johnson & Johnson vaccine rollout off the back of concerns emanating from America. Professor Helen Rees is the chairperson of the South African Health Products Regulatory Authority, or SAHPRA. Professor Rees, the pause on the Johnson & Johnson vaccine rollout has now been lifted. There are those who are critical of that decision in the first instance, saying it was just extreme caution.
It certainly was cautionary. We received reports from the United States of 6 cases of a very rare condition that combine thrombosis in the brain with something called low platelets, which is part of your clotting mechanism. This is a very rare condition. There were 6 cases, but out of nearly 7 million people who've been immunized.
There is currently no proof that blood clotting events were caused by the vaccine. But even if they were, you are far more likely to develop blood clots from a COVID-19 infection than from getting vaccinated.
The benefit from stopping yourself getting COVID infection greatly outweighs the risk of the vaccine. I fortunately have had it already. But if I was offered it again, had I not had it, I would definitely take the vaccine.
It's safe to say very little about this virus has been predictable. The countries that were expected to do well have been some of the countries that have struggled the most. So yes, South Africa has met its fair share of challenges, but we are not the only ones. And now the challenge is some of those countries that do have the resources want to keep them for themselves.
We saw this in Europe, not wanting to export the AstraZeneca to the UK. But now we've seen there's a huge wave of infection in India. Now we're seeing the Indian government saying, listen, we have to now prioritize the Indian population because we're under huge pressure. So that could also become a barrier if countries of manufacture are now under domestic pressure themselves and exports stop.
Securing the vaccine is one thing. Now the world faces the biggest logistical challenge we have ever encountered, because the vaccines are going to be useless if they don't get into the arms of the people who need them. The partnership between the private and public sectors will play a crucial part in any successful rollout. One of the major local players will be the pharmaceutical giant Aspen Pharmacare. Stephen Saad is the CEO. So what is the Aspen facility offering South Africa?
I think the Aspen facility offers South Africa absolute vaccine security of supply.
President Ramaphosa and Minister Mkhize visited Aspen's manufacturing facility in Gqeberha just before Easter. There it was announced that at least half of the South African population would be receiving Johnson & Johnson vaccines manufactured at that plant. Saad is confident they'll be able to meet the national demand.
Aspen can make nearly 1 million doses a day. We make about, probably our capacity is at 25 million doses a month. I mean, and that's very big capacity. It's more than we could ever roll out.
One of the concerns around the Pfizer vaccine is that it must be stored at ultra-low temperatures. But Beyond Wireless CEO Ian Lester says that's only during bulk storage.
As far as bulk storage is concerned, vaccines like Pfizer, and there are others, need to be stored at ultra-low temperature, so minus 70 degrees.
Lester is the man behind this homegrown device known as the ICE3, which can remotely monitor vaccine temperatures anywhere across the globe and has a battery life of 5 years from a single charge.
However, when they come out of those depots, they are perfectly stable for prolonged periods of time, in the case of Pfizer, for up to 5 days at 2 to 8 degrees Celsius.
The ICE3 allows distributors to see the exact temperature of a batch of vaccines at any given time. It can even sound the alarm if a consignment deviates from a given route. It also uses GPS to track location, and they're already in use right here in South Africa.
And then also companies like Dis-Chem Distribution, United Pharmaceutical Distributors, which is part of the Clicks Group. So encouragingly, there are several companies in South Africa that are already using this technology and have been using it for some time.
Professor Mahdi says, like it or not, COVID-19 is not going anywhere anytime soon.
The virus is going to continue circulating, and that is something we need to start developing some comfort with, that this virus is not going away. It's going to be here for the rest of our lifetimes.
And while the current batch of vaccines might not protect you from contracting COVID-19, they will protect you from severe disease, hospitalization, and death.
For me, a good case scenario is getting to where we are with seasonal influenza, which each year kills roughly about 10,000 to 11,000 South Africans. And the way to get to that good case scenario is to ensure that we can get a high-risk population vaccinated as quickly as possible to protect them not against infection, but to protect them from being hospitalized and dying from the illness.